In this video we will talk about how to get rid of toe fungus. Toenail fungus treatment using apple cider vinegar. Don't forget to like, share and subscribe to our YouTube channel to be notified when we upload new videos daily. Toenail fungus treatment using apple cider vinegar. Nail fungus refers to a fungal infection that starts underneath your toenails. It could cause discoloration, thickening, or crumbling on one or more of your nails. This is a frustrating problem, so you'll naturally want to get rid of nail fungus as soon as possible. Toenail fungus can be an embarrassing and persistent problem. Many of the over-the-counter medications used to treat it are harsh and often ineffective, and prescription medications can have strong side effects. This is why many sufferers of toenail fungus seek a more natural and more effective treatment. One such treatment is apple cider vinegar. It is natural, has limited side effects, and it is much less expensive than over-the-counter and prescription remedies. Symptoms of toenail fungus. You may have nail fungus if one or more of your nails are thickened, whitish to yellow-brown discoloration, brittle, crumbly or ragged, distorted in shape, a dark color, caused by debris building up under your nail, smelling slightly foul. Nail fungus can affect fingernails, but it's more common in toenails. Toenail fungus treatment using apple cider vinegar. Making a vinegar soak. If you want to try treating your nail fungus with vinegar, then the best thing to do is soak your foot in a vinegar-water mixture. Diluting the vinegar is important to prevent it from irritating your skin. Try a daily soak and see if it helps clear the infection. Trim your nail back before soaking your foot. If your nail is covering the fungus, then topical treatments won't work very well. Take a clipper and trim your nail back as far as you can. This helps the vinegar reach the fungus and kill it. Mix 1 cup 240 milliliters, each of warm water and white vinegar into a bowl. Find a bowl or bucket that you can fit your foot into. Pour both vinegar and warm water in, then stir them together. You could also use apple cider vinegar instead of white vinegar. Both contain similar amounts of acetic acid. Soak your foot for 10 to 20 minutes. Place your foot into the bowl and make sure the water covers your infected toe. Then keep it there for 10 to 20 minutes so the vinegar can soak into the fungus. If you have any cuts on your foot, the vinegar may sting a little. This isn't dangerous. Repeat this soak twice a day until your symptoms disappear. Nail fungus is tough to get rid of, so it'll take a while. Soak your foot with vinegar and water twice every day. If you see some improvement after a few weeks, then you can continue. If you don't see any improvement, then see a podiatrist for further treatment. If your nail grows, trim it back again so the vinegar can reach the fungus. This could take several months to work. If you can't keep up with soaking your foot twice a day or the fungus doesn't seem to be getting better, then see a podiatrist instead. Directions for use. One of the more common ways to use apple cider vinegar as a toenail fungus treatment is to use it as a foot bath. The home remedies for toenail fungus. There should be enough fluid in the basin to cover the toes completely. For the most effective results, use warm water for every other foot bath. Use cold water the other times. It is recommended once a day but no more than 3 times per day. Dry the feet completely after removing them from the water. How to use apple cider vinegar without soaking. Some people do not have the time to take 2 or 3 30-minute foot baths a day. Another way to get the effects of the vinegar is to apply 2 drops of apple cider vinegar directly to the nail bed. Allow the vinegar to sit on the nail bed for several minutes before disturbing it, or the desired effect might not be achieved. This should be done at least twice a day. This method can be used in conjunction with the foot bath. Duration of treatment. These treatments should be continued until all of the diseased nail has grown out and been removed. Once a healthy nail has replaced the diseased nail, it is unlikely that any infection remains. This could take a couple months or more because toenails grow slowly. The diseased nail should be clipped regularly and kept clean and dry. It is important that the toenails are dried thoroughly after these treatments because fungi love moist, warm, dark environments. Because every person's toenails grow at a different rate, the final length of treatment will vary person to person. Caution. People who have diabetes, peripheral vascular disease, or any other systemic disease that affects the blood flow to the feet should exercise caution when trying to treat diseases of the feet. These diseases can cause the person to heal more slowly and become more susceptible to infection if a wound occurs on the foot. When to see a doctor. You may want to see a physician if self-care steps haven't helped and the nail becomes increasingly discolored, thickened, or deformed. Also see a doctor if you have diabetes and think you're developing nail fungus. Warning: none of the information on our videos is a substitute for a diagnosis and treatment by your health professional.